Hey, everybody, welcome back to another episode of the Energy MD podcast. Super excited that you're here with us today because, as you know, we help people with chronic fatigue, ME/CFS, and long COVID get their lives back by going after the root causes. So these are heavy metals, chemicals, molds, infections, and trauma. And I'm so excited today because we're going to be talking with one of my good friends who's also a trauma expert, Dr. Aimie Apigian. So let's learn a little bit about Dr. Aimie. So she is a former foster mom, adoptive mom, and general surgery resident. She's a double board certified physician in preventive medicine and addiction medicine with a double master's in biochemistry and public health. That's a lot of doubles. She now bridges the world of functional medicine, neuroscience, and trauma work to create online educational and experiential programs for individuals around the world to accelerate their trauma healing journey and teach professionals through her certificate training program how to do the same for their patients and clients. You can find her on YouTube, Instagram, and her website, traumahealingaccelerated.com, for free educational content around how to know if you have stored trauma in the body. Dr. Aimie, thanks so much for joining me today.
Absolutely, Dr. Evan. It's my pleasure. It's always good to see you, always good to spend time with you, and happy to share with your audience.
Yeah, I'm so excited about learning from you. So let's just dive right into it. Let's talk about the difference. A lot of people get confused about the difference between stress and trauma. How do you differentiate those two?
Yeah, and when I was going through medical school, and maybe hopefully you were taught differently, but when I was going through medical school, I was taught like fight, flight, or freeze. And it was just kind of all lumped in together as this was your stress response, this was your survival response. And actually, there is more to that. And as I began to have to learn this with my own body because of my health issues at the time, I started to realize, no, like there's a big difference between the fight and flight and this thing called freeze that I was still figuring out, like, what even is this? What seems to just take over my body in the moment? My mind gets frustrated because it's like my body shuts down and my mind didn't want my body to shut down. But my body seems to be doing something. It feels like there's this internal, and I'm kind of twisting my hands for those who can't see me, this internal sensation of like paralysis that then takes me into this place that I'm overwhelmed all of a sudden. And I am not even listening to the other person anymore. I can't even hear what they're saying anymore. Like I'm in my own world, I'm in my own thoughts. And what is this? And so as I was figuring this all out, that's when I started going into different trauma therapy trainings. So I went into somatic experiencing, neuroaffective touch, started doing an instinctual trauma response model, trying to figure out what was happening in my body and really what I needed to do in order to get it back into a place of health, since it was already starting to affect my health. And what I came to find was that the stress response is this adrenaline generated response in the body. And we're all familiar with that adrenaline. We're all familiar with cortisol being our stress hormone. And that stress response is always something that the body senses is a potential danger. It doesn't even need to be real, Dr. Evan. It doesn't even need to be real, which is the scary thing. But it's anything that is potential danger, potential threat. And it's just this, my body, and I can even sense it right now, like it goes like, woo, like it's this higher alert. And the intention of the stress response is to lean in and figure out what the problem is. Is this a problem? Is this a threat? Is this a danger? And if so, what do I need to do in response? So that if I were a firefighter, my response would be like, all right, I'm throwing on my gear and I'm driving towards the fire and I'm going to put this fire out. And that is a response, so that the body has this response that is a very active response. Like that's why it's the fight or flight, right? Like I'm running and I'm either running towards something or I'm running away from something, or I'm fighting, and whatever that means. But it's a very active, high energy process. But that freeze moment, Dr. Evan, that freeze moment where I stop being in movement, I actually stop being able to respond to whatever is happening in the moment. That's the moment. And it is a moment in time that our body switches from, oh, I guess this is too big for us. And instead, we need to shut down and conserve energy. And it goes into the trauma response. So the stress response is something that's really high energy. And I'm actively working to solve this problem. I'm leaning into it. I think of hiking because I've spent a lot of years in my life hiking. So I think of like this big mountain, right? Like big mountain. Mount Kilimanjaro is always one that I've wanted to hike, and I haven't yet. But if I were looking at the mountain and be like, all right, this is a big mountain and I've got it. Like, let me tackle this mountain. Let me figure out how I need to scale this mountain or scale the problems in our life. Let me figure it out. And there's an energy to that. There's a movement to that. There's a flow to that. There's a response to that. But the moment that our body like looks at the mountain and says, oh, I can't do that. That's too big. That moment is when our body goes into this other response. It's very different than the stress response. It's a low energy response. It feels heavy. It feels overwhelming. And that is the trauma response. And it has a very different physiology, the completely different operating system for our body, because it does go into this immobilization. Stress response is mobilization, movement, action. Trauma response is immobilization. It starts with that freeze moment, and then it goes into just this heaviness and internal collapse and kind of a shutting down that some people may be familiar with.
And in both ways, the body is trying to protect itself, it's trying to help itself, right? It's a compensatory mechanism that's generally that the body is trying to do for the betterment, right?
Absolutely. And we have this thing called the autonomic nervous system, and that's what actually controls which of these states are we in. Are we going to be in the stress response, or are we going to be in the trauma response? Hopefully, we'll have moments of neither and be in the parasympathetic state, at least sometimes. But the operating system is always doing what it thinks is best for our survival, always. And it takes everything into consideration, which is actually rather remarkable when you think of it. And our autonomic nervous system, which is the unconscious, you can think of it as the unconscious mind. The unconscious mind, that's actually nerves in your body that are picking up, gathering information about everything, Dr. Evan, everything not only from your external environment, but your internal environment. So how much ATP do I have? How much magnesium do I have? How much zinc do I have? How much of these cellular resources do I have? Because it depends on my resources in that moment of whether I can actually respond to a problem in my life, or if I'm going to get overwhelmed because I don't feel like I have enough, or I'm not enough, or whatever those stories are that we create. But that autonomic nervous system is actually gathering all of this information from our body itself. And that's why it very much is this adaptive mechanism that is very fluid, moment by moment. It can decide, no, I don't, we need to go into the trauma response, based on the minute, second by second information that it's getting from the cells, from the tissues, from the organs that tell it we're being stretched beyond what we can sustain. We need to actually shut down because this level of energy, this level of response, this level of danger is unsustainable for us. And we might lose our, what we call in medicine, homeostasis, or this ability to keep my systems, my physiology, even down to my blood pressure, my blood sugar levels, my heart rate, my oxygen levels, my CO2 levels. I might not be able to keep those at a healthy level. And so in order to keep those at a healthy level and keep my actual human body alive, I'm making the decision to shut everything down. It's amazing how much goes on the unconscious level that we're not aware of.
Yeah, and it seems like a more dramatic response is like passing out, right? It sounds like, because you were talking about maintaining homeostasis, is that sometimes if something happens, sometimes the body will just pass out in order to reequilibrate.
Yes, and that's actually what it's trying to protect us from. So when our body goes into that freeze moment, it's actually trying to protect us from passing out. Now, some people still pass out, but that's actually what it's trying to protect us from, which is fascinating to think that, if I remember, I go back to a moment maybe in my general surgery residency where I'm standing in front of, this surgeon and I'm just the resident. And maybe I forgot to do something and he's looking down at me and he's pretty stern and he's pretty upset. And I go into that moment of like, oh, just like I freeze inside, right? I freeze inside. And in that moment, it's actually protecting me from passing out. It's actually protecting me from this other bigger transition or shift in my body that would that would compromise my heart rate. Like, we're protecting you from a heart attack. We're protecting you from all of these other things that could happen if our body didn't have the capacity to go into this other response state and say, no, we're gonna kind of shove that aside. We're gonna make that feel distant, and we're just gonna kind of hunker down and go into our little cave and protect ourselves.
Mhm. And so normal stress response would be kind of the first thing of what you're talking about, where you get flooded with a bunch of these different hormones and you can take action. You can run, you can fight, whatever it is you need to, right? So that's like normal response, and then your body comes back to equilibrium. But this is the trauma response, which is the immune system's inability essentially to manage that stress response. Is that accurate?
Yes, and I don't usually go this deep into a conversation with someone, so I love that we are able to do this. That trauma response only happens when our body feels like it could not have a complete stress response. And so if it feels like, no, this problem is too big for me, then it's going to shut down to conserve energy. And so it's the shutting down, it's the immobilization that actually brings on the trauma response. So that as long as we are able to stay in response, yes, and our bodies are flooded with these hormones. But what if in that moment we're still flooded with all these hormones, but we go into a moment of that paralysis, that freeze, and then the trauma response? We still have all those hormones. They didn't magically go away anywhere. And that's where we really start to see this connection between trauma and symptoms, trauma and chronic conditions, trauma and disease, because it's all of those hormones, especially the adrenaline. Adrenaline does a lot of damage to our tissues when we don't metabolize it, when we don't actually use it up. And yet when we go into that trauma response, we're not using it up. And so you can think of it as if you're driving a car, and that stress response is if your foot is all the way down on the gas pedal, like metal down, like we are speeding in this car. We're stressed out. Maybe we are late for a meeting, so we're stressed out, right? Like we're driving fast. That's our stress response. And so there's all these hormones that are getting released as long as that foot is on the gas pedal. But the trauma response would be the equivalent of throwing on the emergency brake. Your foot may still be on the gas pedal, Dr. Evan. That may not have changed. But what is stronger? Well, the emergency brake is actually stronger than the gas pedal. And so the true damage, like the most damage to our physical health, comes from when our emergency brake is on, when our trauma response is on, but yet our foot is still on the gas pedal, and it's unleashing all of these hormones, the adrenaline, the cortisol, that we're not able to actually metabolize and use up. And so they're just sitting there, and they start to cause damage to our tissues. This is a big driving force for fibromyalgia or chronic pain, or any of these like syndromes that can happen. There's such a strong correlation with those with the trauma response because of this factor. We're not able to actually be in the movement that would be in for the stress response to complete it. And so our body goes into the trauma response, but yet all of these hormones are still there and causing their damage.
Mm-hmm. Yeah, that's a great explanation. I love that visual of the brake versus the gas. And so in nature, would animals shake at this point, right? Don't they shake out trauma?
They do, yeah. So let's take, and there's a great video on YouTube for anyone who wants to find like the polar bear somatic experiencing Peter Levine video. And it's this video of this polar bear that's being chased by a helicopter. They're needing to tag it for some reason, right? So the helicopter's flying low. Here's this polar bear. He's running because he's in the stress response, right? And that's what animals do. Like they run. When I look at my dog, and when she hears a sound, like she leans into it. She doesn't paralyze, like she leans into it. She goes for it. So they're in the stress response, and then they throw this, like dart of anesthesia. Now that causes the immobilization. And that's a really important point that I just want to pause right there and mention, is that it doesn't matter the cause of the immobilization for us, whether it's something physiological like anesthesia, or like toxins, or like mitochondrial inefficiencies, or if it's something emotional or psychological, like relationship stress, for example. It doesn't matter the cause of the immobilization because the end result is still the same. My body goes into a trauma response. It's no longer able to stay in the stress response. So for this polar bear, they throw a dart of anesthesia and it falls asleep. But again, like what I was just saying, where did all that adrenaline go? Like it didn't magically disappear. It's still there waiting to be discharged. And it has to be discharged for us to complete a stress response. And this is where I see most people going wrong, is that they're not aware and don't know how to complete a stress response. And so they start to just accumulate more and more and more. And then eventually the body's like, I can't hold anymore. I have to go into the trauma response. And so that adrenaline that's right now in the polar bear, it's still waiting. And as he wakes up from the anesthesia, you start to see his movements come out and his paws start to move. And actually what you see is him going back to the movement of running that he was doing before the immobilization. And there's this massive discharge and he trembles and he shakes, but it's in this movement of, I'm still completing what I started back there. And now I'm completing it. And that's what actually allows us to come out of that trauma response and discharge all of it and actually come back to a baseline of health. Since most people are not aware or don't know how to actually discharge and complete either a trauma response or a stress response, it just accumulates in our body until one day, perhaps like my body, like it just shuts down and it won't get out of bed that morning. And so there's this accumulated effect that happens that is underneath the surface. If we were actually listening to our bodies, we would be able to feel it building. But most of us are also not listening to our bodies until one day it won't do what we want it to do, and we're forced to pay attention to it.
Thank you. So then how do you complete a stress response? What's the right way to do it?
Yeah, I've got a whole 6-week module that I'm teaching on it right now, Dr. Evan.
Awesome.
So it's more than just like this simple answer that I'm going to give you, because here's what complicates it. We have patterns, and the body establishes patterns that you could interchange that with habits. The body has habits, and the body develops habits in order to make things easy and not have to think about what I'm going to do every single time because, oh, we've done this before and I know what to do next. And so the body has these habits of doing things. Well, for most people, they started experiencing moments of overwhelm in their early childhood, long before they have conscious memory. Maybe their parents read the books about having you cry it out at night, and you cried it out at sleep, and you actually fell asleep in a trauma response out of exhaustion rather than feeling safe and secure. That's just an example of the moments of overwhelm that we can experience in early life. But because it happened early, and the earlier in life that it happens, the more that these become a habit for how our body operates. And we can have the habit of learned helplessness. So that even though our mind tells us that it wants to do something different, even though our mind may tell us like, yeah, we can tackle this problem, we've got this, our body is in the habit. It has had a habit for decades of, no, we just know that we're not big enough. We just know that we're not strong enough. We just know that we're not smart enough. Everything feels like it's too much. Everything feels like it's unmanageable. And so it complicates all of us now as adults to be able to say, oh, well, let me just start completing my stress responses. You actually may need to work with your body first to work with that habit of learned helplessness that makes your body immediately go into a freeze response or a trauma response without you even having the choice to be able to make of, do I want to do this or do I not want to do this? Do I actually want to complete the stress response? The ideal, like how to complete a stress response, is that discharge of all of the adrenaline. So the ideal stress would be something that's short term, right? That's the ideal. The ideal is something that's short term, not something that's chronic. Short term, and something happens. And in that moment, I take action. And we can look at the time frame even of these different hormones. The adrenaline hits our system within 15 seconds, which is interesting because we can tell that when there's a sound, when there's a noise, when there's something that we see, our system lights up faster than 15 seconds. What is that then? That's our sympathetic nervous system. That's, again, our autonomic nervous system, and it kicks in even before adrenaline is there to come in. But the adrenaline has a purpose, and that adrenaline is to move us. Like, the only intention of adrenaline is to get us to take action. And so it literally goes to our tissues. It starts to move blood around to our muscles so that we will take action and have the energy to do so. It's actually when people feel the most alive. And that's why some people will intentionally stress themselves out, or maybe they become adrenaline junkies, because that is when they feel most alive, is when they've got this adrenaline, because that's what it makes you feel. It makes you feel powerful. It makes you feel strong. It makes you feel capable. And that's when moms can lift cars off of their children who are pinned underneath. Like, it's this superhuman effect with adrenaline, but we only have it for 15 minutes. So there's this wave of adrenaline, and it's out of our system by 15 minutes. So that means the peak is earlier than that. And that's when we need to be using the adrenaline to take action. So that if in that moment, I'm like, oh, well, I'm busy right now, let me finish this call. Let me finish doing this. Let me finish doing that. We've lost our window of opportunity to actually take action to complete the stress response. And so we actually need to just align ourselves with the rhythm of our hormones, adrenaline hormone in this example, and align ourselves with, no, like, when I feel that stress, when I feel that response, like, I need to let my body have the response that it needs to have so that I can be in movement and do something about it. And then once we do something about it, if we feel complete with what we've done, and that would be the other important piece, Dr. Evan, is, am I complete with what I've done, or is there still something unfinished? If there's still something unfinished, you haven't completed the stress response, and you're not going to get that effect. When we feel like, no, like, I've completed what I needed to do, I have done everything that I can do at this time, then we come back to a sense of safety, and we have to do that intentionally. When you look at the animal kingdom, there's orienting, meaning looking around in my environment. What's going on right here, right now? Am I safe right now, or is there another threat? Is there another monster? Is there another danger? And this orienting, and yet in our world, we're so much into our cell phones, we're so much into our screens, right? Like, our focus is inward, and we're not like out, like, scanning our environment and getting that sense of, okay, like, right now, right here, I'm good. Like, I'm safe, I'm secure right here, right now. And that would be the final resolution that we have to have in order to complete a stress response and let our body have that full resolution. So it's this combination of responding to the degree of the adrenaline levels that your body produced. If I don't respond to the degree that my adrenaline levels were in my body, there's going to be a mismatch, and I'm either going to still have adrenaline left over that I didn't discharge, or I'm going to have overextended myself and be pushing myself into fatigue, into these areas where I only needed to respond this much because I only had this much adrenaline, but I chose to respond this much. And now I've overextended myself. So it's matching ourselves up with, what does my body need right now? What is the response that my body needs to do? Let me take that response in this window of time that I have, and then let me come out and let me orient, let me ground, let me have that reestablishing of a sense of safety, so that I'm not carrying it around all day and still thinking about that thing that happened this morning because I didn't actually resolve it.
Thank you for that explanation. So it sounds like is it out yet, or you're working on this new program?
No, this is out. Like, this is one of my biology of trauma modules. So I have
Awesome.
6 modules in my biology of trauma, and I walk people through all the different aspects of the trauma response that they need to work on. And so I encourage people to start with the first module, which is the freeze and overwhelm module. But here's the thing, Dr. Evan, that when the body starts to come out of a chronic freeze response, meaning, like, this is just kind of where I live chronically. I wake up in overwhelm. I'm overwhelmed all day. I go to bed in overwhelm. So that's a chronic trauma response. And when the body starts to come out of that, and it needs very specific things to start to come out of that, when it comes out of that, it goes back into the stress response. It actually doesn't go back into the parasympathetic, all is well. No, like we went into the trauma response from the stress response. Like that was the path into that trauma response. And so that's our path back out. And so many people will start to experience like this energy that feels like it's anger, that feels like it's anxiety, and they don't know what to do with it. And they think they're doing something wrong. And it's like, no, like this is great. Like your body is now ready to start to digest and discharge all of that adrenaline that it's been holding on to that charge. And that's what's been causing a lot of their health issues as well. So it's a good sign when they're actually able to start to feel a lot of that heat and flushing and energy, even though it can feel very uncomfortable, especially for people who have felt uncomfortable feeling angry in the past. That can be that's the next stage that we need to work on is, okay, like we've got this and this is what we do with it. We actually learn how to move through it and move it. Like we've got to be in movement to discharge all of the adrenaline. But it also can't just be random movement, Dr. Evan, because I see a lot of people being like, oh, well, I exercise a lot. Doesn't that count? Like, no, it doesn't. And here's why. The stress response is in response to something that feels like a danger. And so if I have a danger coming over at me from this direction, maybe from my left side, if I do exercise that's directed toward my right side, my body is still like, but there's danger over on the left side. Like we haven't addressed the danger. And so the movement that we do needs to be specific to the type of danger that we're experiencing. So we can't just do like general shaking and expect that to discharge adrenaline and to complete a stress response. It needs to be specific to the threat and the danger that the body feels in that moment.
Sounds like a great course, great module.
It is.
So let's go back a little bit on trauma, and maybe you can define for us what trauma is so we can all make sure we're on the same page.
Yeah. And, when you ask me that, it takes me back to my days when I thought I knew what trauma was. And that was when I became a foster parent. I had just finished my master's in biochemistry, had a few months of space before I jumped back into the third year of medical school rotations at Loma Linda University. And I was like, let me use this time to become a foster parent. Again, I had my own trauma to work with. I know. But at the time, I thought this was a great idea. And I thought that I knew what foster children needed. I thought that they needed love and stability. I could provide that. And so this seemed like the perfect time to do that. And so when Miguel came into my life and my home and my heart, I knew what he needed. And I started to give my love and support and stability to him. And what I had to learn the hard way was that it was actually my love that was triggering him. So I had to unlearn everything that I knew about trauma and really come down to, okay, so what is trauma? Especially then when I started to have my own health issues that I knew from my studies that were related to trauma in childhood, like the adverse childhood experiences. And yet I looked at my childhood and I was like, no, like I don't see trauma, especially when I compared my childhood to Miguel's childhood. Did not see trauma. And so this required me to say, like, I don't think that I really understand trauma then, because why would I have what I now call like a trauma body when I don't think that I had trauma? And as I started to study the body and the nervous system and these reactions that were happening in my body, I realized that trauma is anything that for any reason at that time in our life overwhelmed us and overwhelmed our ability to respond in the moment to the stress, overwhelmed our ability to understand and process what was happening. And when I thought of it in that way, I could look back at my childhood and be like, were there times when I didn't understand what was happening, when I felt alone, when I felt lost? Yeah, there were times in my childhood, quite a few, in fact. And so that's when I was started to see like, oh, so those for me, for my body, were moments of trauma. That anything for any reason at that time in our life overwhelmed us. And those experiences are then what are stored in our autonomic nervous system and create these habits, these patterns of going into the trauma response in response to things that maybe are stressors that other people can handle, but we're not able to stay with that stress anymore because now we have the habit. We've had this pattern of going into the trauma response since childhood, perhaps because we were overwhelmed with a lot of things. And that was just, we came to know that we get overwhelmed with everything, like everything. And so that's my definition of trauma now is I'm not looking for an event, right? And people who come through my biology, trauma, health coaching, like that's one of the things that they're always confused on is they look at our assessment forms and they're like, but where is the assessment form where I get to tell you everything that's ever happened to me?
Right.
I'm like, oh. Like, actually, we're not looking for events. We're looking for what are the habits, what are the patterns that we see in your nervous system. And that's how we know back somewhere in the past and along the way, your body has been going into the trauma response quite a bit.
Yeah, for me, this is really clarifying, and it allows me to have a lot more acceptance for myself in that we all have trauma. And it's really just a question of kind of like more about our response and less about the thing that actually happened. Because my understanding is that there are people who have really serious trauma and they'll have the same response as somebody who has something that would necessarily be considered more mild.
Exactly.
Right? So we all have trauma, and consequently, we all need to work on our trauma.
This is true.
Yeah. So let's talk a little bit about unresolved stored trauma. How does somebody know if they have it?
There are 3 ways that we can easily know if we have unresolved stored trauma in the body. And we're really looking for these habits that I've been talking about. And we can look at our thoughts. And there are certain thoughts that are what I call trauma thoughts. When you have this thought, you are always in a trauma response. And that thought would be, I can't do this anymore. Just that moment of feeling overwhelmed with it all. And you have the thought, I can't do this. That is only a thought that we have when our body is in a trauma response. If our body is in a stress response, our thought is, this is a lot. What do I need to do? That's a thought from the stress response, but from a thought from the trauma response is going to be, I can't, like, I just can't, I can't do this. I can't. That thought will only come when our body is in a trauma response. So when I learned that, because I, for the longest time, just always saw it as the top-down approach where my thoughts were directing my body. And when I realized that, no, actually my body is what drives my thoughts, then I could take those thoughts and be like, oh, this thought is just giving me information. I don't need to judge the thought. I don't need to try to change my thought. This thought is giving me information that my body has gone into a trauma response, and I get to use my tools that I know how to support my body while it is in a trauma response now. The body sensations would be another way to know if we have some unresolved stored trauma. So anytime that our body is in a trauma response, it will feel heavy. It will feel just like everything is hard to do. Maybe there will be like a glass of water, but it's just 2 feet away. And it feels hard to reach for a glass of water that's 2 feet away. And you're like, it's only 2 feet away. Like, why is this so hard? Why do I not want to bend down and pick this thing up off the floor? Why do I not want to do this? Whereas yesterday, I seemed to have no problem. Like, it wasn't even a thought of, yeah, let me just take 2 steps and grab this glass of water and drink my glass of water. It's like, it's not even an issue that we think about, but all of a sudden when our body goes into that trauma response, everything feels harder. We may notice that our thoughts are slower and we may walk slower. We don't usually notice our breath, but if we were to notice our breath, we would notice it was a lot shallower, slower and more shallow. So anytime that our body just feels heavy, and for a lot of people with chronic conditions, this is their constant reality, right? Like the fatigue and the pain and just the aches, the heaviness. that is a body in a trauma response, so that our body can be in a trauma response in association with our physical health. And that would be the last way to tell that we have unresolved stored trauma, is our physical health. Do we have one of these conditions? Autoimmunity, the chronic pain, chronic fatigue, fibromyalgia, anxiety, depression. Do we have these things that indicate that there is imbalance in our autonomic nervous system and it's gotten stuck? It's gotten stuck either in the stress mode, or it's gotten stuck in trauma, or we just go back and forth all day long between stress and overwhelm, and stress and then overwhelm. That is all these signs of the unresolved stored trauma.
Thank you for that. And so then for all of us who have this stored trauma, how is it showing up? So it sounds like with a lot of these different health conditions, is that correct? Is it showing up in any different ways that we need to talk about?
I mean, it's going to show up in every area of our life, because just like the emergency brake on in our car, it just becomes our operating system. So it becomes how we interact in relationships. And when we're in the trauma response, like, we really don't like to be interacting with people because we don't feel like we have the energy. Relationships feel hard, right? Like communicating feels hard. And people may even tell you, right, like, are you upset? And you're like, no. And they're like, oh, your face just looks like it. Because that's what happens to our facial muscles. Like, our facial muscles actually lose their tone when we are in the trauma response, because that's part of the dorsal vagal response, shutting down the ventral vagal response. And so there's all these changes that happen that just make everything harder. We start to cut more corners, take more shortcuts, because we're looking for the easy way. Like, we don't have a lot of energy. So we start being very selective about, what am I going to use my energy for? How am I going to use my energy? Because I don't have energy for everything. And whatever we don't want to have energy for, then like it either doesn't happen, or we're taking shortcuts to get it happen. And then at the end of the day, what do we find ourselves doing? Are we finding ourselves just kind of sitting there, maybe drinking an extra glass of alcohol or wine? Or like, are we just mindlessly doing things, mindlessly watching a movie, mindlessly scrolling through social media? Mindlessly doing things is another way to know that our body's in that pattern of like, I just don't have the energy. I don't have the energy to be present. I don't have the energy to be thoughtful about what I'm doing. And then another way is to look at, if we are struggling with our energy levels, what are we needing to do throughout the day to push ourselves to get through our work, for example, or get through our day, or get through getting the kids to school and to their soccer games? What are we relying on? And those would be the coping mechanisms. So we can look at coping mechanisms, and there's all kinds of coping mechanisms that come out when we are either in incompleted stress responses and stuck in that anxiety of the stress response, or stuck in the heaviness of a trauma response. Is that in order just to get things done, we've got to make some of those feelings go away. We can't be that tired. And so we reach for caffeine and maybe a second cup of coffee, or maybe we're finding that we crave foods that are actually a food sensitivity for us because they're giving us that energy with the histamine release. There's so many things that start to just crop up into our life that we use to manage our symptoms and to not feel that in this moment, because I want to try to get this done, or I want to try to feel this way. And a lot of coping mechanisms start to come out.
So it seems like we're mainly talking about emotional causes of trauma, but what about like some of the toxins, the heavy metals, the chemicals, the molds, the infections? It seems like they also cause trauma in the body, and they also, negatively affect the autonomic nervous system. How do you see that interplay between those toxins and trauma?
Yeah, so let me go back to my definition of trauma, Dr. Evan, which is anything. Anything.
Gotcha. Yeah.
Toxins, parasites, biochemical imbalances, anything that for any reason at that time overwhelmed our body.
Mm-hmm.
And so the more toxins that we have, for example, the more our body's already holding all of this stress. I see that as a stress. And then it doesn't take much more stress to just overwhelm our body. Or maybe we already have all of this other stress, and maybe it's mold stress, maybe it's a combination of work stress. Maybe it's a combination of these different things, but then we get an infection. And that's what then puts us over the edge into that, okay, now my body really cannot respond. It's too much. And I feel like that's one of the things that I really want to bring into medicine is this idea that no, like trauma is not just emotional. Trauma is not just psychological. There are these kinds of things that actually put the body into a trauma response. When I had mold toxicity, it put my body into a trauma response. That was not emotional trauma, but that was still a trauma response. Mm-hmm. And so for me, that's been really helpful to distinguish a trauma, which again, most people would think of trauma as being an event versus a trauma response, because my body can have a trauma response to anything. It's not going to differentiate something chemical from something viral, from something emotional. Like it's just, my body is doing the best it can at all times, and it can only hold so much. And so anything that for any reason overwhelms our body is going to generate a trauma response. And for so many people, it generates a chronic condition, or that chronic condition creates the trauma response. By the time a person has a chronic condition, they have stored trauma, because you can't have a chronic condition and not have the body go into a trauma response. That's package deal.
Yeah, I'm glad you made that clarification, because it was I who was thinking about the emotional health in here, but you had said everything, so I appreciate the clarification. And so you have a free gift for our audience, the roadmap to healing,
steps
right?
to identify and heal trauma.
Awesome.
And yeah, in that, I actually have an assessment that people can take, so that if they're confused and not sure, I don't know if I've had trauma, I hear what Dr. Amy's saying, it doesn't really need to be an event, I don't know, they can go in there and they can look at, okay, is this something that I experience? Is this something that I feel? How often do I have this? And it will give them a helpful assessment of if they have stored trauma in their body, and that's something that their body is currently carrying and holding.
And then the solution is to go to your website, right? Trauma Healing Accelerated. And tell us what happens next.
Yeah. So in the big picture, the solution for stored trauma is there's different steps, and we have to start with this connection with the body, but in a safe way. So we have to learn how to safely open up, because a lot of people are trying to open up yet before it's safe. And so that's where I've started my people through programs. And even though they were coming to me for health issues or a substance use issue, I started to realize, like I've still got to get them into this basic understanding, connection with their body, so that their body can start to complete some of these responses and not accumulate more stress and trauma over time. And so that's where I developed my 21-day journey. I lead everyone through that. Like that is the starting place. And it's the starting place that Dr. Steve Porges talks about with his polyvagal theory. We have to start with safety. We hear from somatic experiencing and some of these other programs and people where they talk about, like, we have to set the container. We have to set the foundation. We have to set this regulation in piece. All chronic disease is being driven by dysregulation of our autonomic nervous system. So bringing in that regulation piece is essential, or else we'll still just be always putting Band-Aids on our symptoms. And so that's what people start to experience in that 21-day journey, is just this sense of like I'm holding things together, like things are contained. I'm not spiraling out of control with my emotions or my reactions and triggers, etc. And it's been fascinating to see that people, how much their physiology, how much their physical health, their symptoms change just doing these 21 days of very basic somatic exercise, connecting with their body and learning how to create that felt sense of safety, create that felt sense of support in the moment. So that's, and for me, like when I started to see those numbers, that for me was this validation of, yes, like this is exactly where we need to start, even in medicine, being able to start with this sense of regulating the autonomic nervous system, because it's also what changes the biology, not just the diet and supplements, though that is also an essential piece.
Yeah, I'm glad that you said that because I can't tell you, the more that I've learned and the better I kind of get at my job, the more I realize how important trauma is and dealing with resetting the autonomic nervous system. And if you don't do that, you're just not going to have success in whatever you're trying to treat.
Yep. You can't out supplement trauma.
That's a good bumper sticker.
My new tagline.
I love it. Awesome. So anything else you want people to know about you, what you're doing? Any last words you want to leave us with today?
I always like to leave people just with this hope that, like, no matter how old you are, there's as long as you're still breathing, as long as your body is still keeping you alive, we can work with the operating system of your body and make things better. And then I do have a free online event coming up that people are welcome to join. August 1 is my annual Biology of Trauma Summit. So this is my third annual. And this year's topic is the trauma disease connection, and have almost 50 speakers on this year's summit, going into the details, like actually looking at, okay, how does trauma become a disease? Not just keeping it in theory, but the actual practical, this is what happens and this is what we can do about it.
Yeah, I always love what you do on your summit. It seems like it's different from other summits that I've seen where you're really you're getting to brass tacks and you're really getting some of these experts to share their real secrets. So thank you for the work you're doing.
And thank you, Dr. Evan. Thank you for the work that you do.
Thank you. So thanks so much for coming on today, Dr. Aimie. I really appreciate you educating us, answering all of my questions, and look forward to seeing you soon.
Likewise.
I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.